My name is Ron Fontaine. I'm a general practitioner. I've been working in Kent County since 1982, and I've been working in Bouctouche in this very office since 1986, so 1 year shy of 40 years. One of my concerns as my time in my private practice was coming to a close is that I very quickly realized that I could not find a replacement or find enough family doctors to take all of my patients. And all of a sudden, when I started talking with the people from NB HealthLink, all of a sudden was at least a partial solution to my problem, because at least half of my practice were not able to find any takers. So this was actually a pretty good fit. But the big physical chore that has to be done is certainly the scanning of all the charts to integrate them into the NB HealthLink computers so that they will be available to me. And what I tell patients is that, look, very little will change for you. Essentially, the only change will be you won't be phoning here for an appointment. You'll be using the facilities in Moncton, and they'll be scheduling your appointment here. Otherwise, it'll be the same location. It'll be the same gray-haired doctor giving you the services that he's given you over the almost last 4 decades. I have a vested interest. I've looked after the community for almost 40 years. I want it to continue. Basically, they asked us to be completely out of here for a 2-week period, and they were right on schedule. Physically, things have changed. NB HealthLink did a nice makeover. Big changes, because I went from a paper office to a paperless office, and being someone who graduated from med school in 1981, I'm sure you understand it had its digital challenges, let's say. All the physical changes are nice. It certainly looks brighter, cleaner than it was before. And I have to admit, in this electronic era, I think it will speed up the process of seeing patients eventually and getting things done by computer. In terms of having physicians that are retired, or even thinking about retiring, this has been an excellent segue for myself, because I wish to continue working, and because of staff attrition, I was no longer able to run my own practice. So yes, I would certainly recommend it under that scenario.
We were with Dr. Fontaine when he first started, way back at Stella Maris de Kent Hospital, and then he transferred here in Bouctouche, and we've been with him ever since. Because of the lack of physicians in the region, we were worried, but as soon as we found out that there was going to be someone here, that was a relief. For me, there hasn't been any changes because the continued care was there. It was offered, so it was very good for us.
For me, it was an easy transition, and knowing that there could be other doctors here makes me more relaxed.
It will be nice because if ever your family doctor is not there, or the one that you usually come to is not here, the care can still be continued because everything's electronic now. So everything is there, they have access to your file.
It was very easy. I just called and made an appointment, and it was well received.
I'm confident that NB HealthLink is going to take care of us. The transition has been done so easily that I'm confident that the care is going to be continued.
It may sound a bit trivial, but to me it allows me to still feel useful. I was very fortunate that I was able to pick a career that, after 43 years, I still enjoy it, and I would like to keep on working at it.